Baie welkom by vandag se episode van Op Reis saam met Mia en ja, ek is hier in my kombuis, die plek waar ouers skarrel om kos te maak en kosblikke te pak, maar ook deesdae die plek waar ons skarrel op soek na die naaste multivitamiin wat ons sommer vinnig so in die hardloop op pad na die kar toe vir ons kinders kan invoer. Met die nuus dat daar nou 'n nuwe kinderskiekte is wat tydelik met COVID-19 verband hou en vanaf in Suid-Afrika aangemeld kan word, het ek namens jou met Prof Ameena Goga, sy is 'n pediater en senior navorser by die Suid-Afrikaanse Mediese Navorsingsraad gesels oor Pims-Ts. Is jy 'n ouer? Dan bied hierdie video vir jou alle inligting siekte en gee waardevolle raad oor hoe jy jou kind kan veilig hou. Prof Goga, thank you so much for taking the time to explain a really difficult thing to us. It feels like we are almost just over the worst part of COVID-19 and the pandemic here in South Africa. And now there's a new child sickness. It's called Pims-Ts. Can you please give me a very simple explanation? What is this new child sickness that's related to COVID-19?
No, thanks so much, Mia. So PIMS stands for Pediatric Multisystem Inflammatory Syndrome, so PIMS. And we usually refer to it as Pediatric Multisystem Inflammatory Syndrome temporally associated with SARS-CoV-2. Some people may have heard the term multisystem inflammatory syndrome in children, sometimes abbreviated to MISC, and it's the same thing. And what it really is an immune response to COVID-19 that children and adolescents may get. It's a hypersensitive or hyperinflammatory immune response to COVID-19. And you're right, it has been described fairly recently. I think the first few cases were brought to attention around the end of March or April, and mostly reported from the United Kingdom, followed by the USA. And the CDC and the World Health Organization have subsequently tried to get groups together to decide what is this disease, how do we describe it. It does seem to be similar to some diseases that we have seen in the past. For example, there's a disease called Kawasaki disease. It's also associated with an immune response. It seems to be quite similar to that, but there are specific differences. And it also seems to be similar to kind of toxic shock syndromes that we get from some bacterial infections caused by specific bacteria. Some people refer to it as a fever-related syndrome. So I think PIMS is the tip of the iceberg, and then you may get various levels of reduced severity of the disease. So if you can imagine a triangle with PIMS being at the top, and then you might get layers below that are not as severe. So there are specific case definitions, but I won't go into that now. And I think the important thing to remember is that, yes, it is new, and so it's very scary. It is new, but it's rare. It's not very common, and I think that that's something to bear in mind as well.
What words of advice would you give a parent? I know there was news yesterday that it can be written up people can go to the doctor, and it's like a real thing in South Africa now. Is there any reason to stress or to worry or to panic about this as a parent?
I think the first thing to bear in mind is that the majority of children will still get asymptomatic COVID. And so if you look at the number of cases of COVID-19 that we've had in South Africa, and you look at the total population, a small percentage of those have been amongst children. And so that's the first thing that I want to really put out there, that only approximately 8% of all the COVID cases in South Africa have been in children. And that it's been mild disease. So let that be the first take-home message. The second take-home message is that children who do get severe disease, so severe COVID-19, are children who've mostly had lots of comorbidities. So they've had other infections as well. So that's the second message that I would like to put out there. And the third message, now let's come to PIMS and let's look at what we know about the disease in South Africa. So if you look at the total number of cases of children who've had COVID-19, a very small proportion of them are hospitalized. And of the hospitalized children, a very small proportion of them have Pims.
Yes.
And so let's just get that in perspective. So if you look at Cape Town has been through a wave of COVID-19. They're coming out of it now. If you look at Cape Town, there's been a write-up of the number of cases of children with Pims. And so in our country, and I'm just making sure that I've got the right numbers, in our country, in Cape Town, between the 4th of June and the 24th of July, they thought they saw about 23 cases. And if I just think of Pretoria, if you look at between the start of the COVID-19 pandemic and now, they've seen about 24 cases in total. All of these children have been successfully managed. Yes, they have been quite sick, but they've all been successfully managed. And so let's just see this in its perspective.
That's absolutely true. When it comes to symptoms, I see there's a few things that we've got to look out for. I mean, just not to panic at the first flu or the first runny nose.
Yes.
If you can go into the symptoms, what should I, as a mother and dads, what should we be looking out for before going to the hospital or the doctor?
Okay, so the first thing to know is that usually a child with Pims would have been or should have been in contact with someone who has had COVID-19. Okay, so there's got to be a contact. And diagnosing Pims is a diagnosis of exclusion. So you make sure that the child doesn't have anything else, and then you confirm that, or you investigate whether this child has had a contact.
Yes.
So that's the first thing. So if you know that the child has had a contact and now the child is starting to get sick, you think, well, what are the symptoms that I should be worried about? And I think that that's the question that you really want to focus on.
Absolutely.
And there are different presentations of Pims, but the things to look out for is a rash. So skin rash, the hands, the feet, around the mouth, conjunctivitis, so redness of the eyes, a very inflamed tongue, so kind of the tongue that looks strawberry red, usually like a strawberry red tongue.
Yeah.
And then they'll start feeling very listless. So the child will feel quite listless. They won't feel energetic. And they may have fever. They may have vomiting, and they may have abdominal pain or diarrhea. And so they're very non-specific symptoms, as you can see. Very non-specific symptoms. But if you have a child who starts to look and feel like that, and you know that there's been a contact, then do take them to seek medical care as soon as possible. I guess the next question is, sometimes you don't know if your child has been in contact with someone with COVID-19 because people may have asymptomatic infection. So I think the second step is to just be vigilant. As a parent, pay attention to your child. If they have any signs of some unusual illness, and particularly look out for the rashes. Look out for the rash in the mouth, on the lips, on the hands, on the feet. Be aware of abdominal pain. And some people have described the abdominal pain as being the kind of abdominal pain that one would get with an appendicitis. So be on the lookout for abdominal pain or any diarrhea or vomiting that just seems to come from nowhere, So just be aware, because those are the early warning signs. And if you do have that, then do take your child to seek medical attention. And when you do seek medical attention, make sure that the doctor doesn't just do a SARS-CoV-2 PCR test. So that's the test that tests for the actual virus, right?
Yeah.
Don't do the SARS PCR test. If Pims is suspected, then do an antibody test. Because as I mentioned, so request an antibody test. Because as I mentioned before, Pims is a reaction. It's an immune response. And so you may not have acute infection now. You may have been exposed a month ago, and that's the general duration that most people are describing. You may have been exposed a month ago, and so now you won't have the virus in your nasal, in your nose or in your mouth. you may have antibodies against it.
Is it also as contagious as COVID-19? Let's say we have an outbreak of Pims. Is there a possibility for that, or not really?
That's a good question. And the first thing I want to say is that one cannot have an outbreak of Pims.
Right.
It's not an infectious disease.
Wonderful.
Right? So COVID-19, So COVID-19 is a disease caused by SARS-CoV-2, and that's infectious. So we can spread it and we can get it from other people.
Yeah.
But Pims is a response. It's kind of a response. It's a delayed reaction to an exposure to a disease. So if I have Pims, it means I was exposed earlier, and now my immune system is reacting to what I was exposed to before. So I can't spread it now. When I had the acute infection, which was probably asymptomatic or maybe mildly symptomatic, so I didn't feel really sick, so your child may not have felt very sick, at that point, I may have been able to spread it. But now, when I have Pims, it's an immune reaction and I can't really spread it. Most children are negative on PCR. I hope that answers your question.
It absolutely does. It absolutely does. All right, seeing that our kids have gone back to school, which is wonderful,
Yes.
Do you have any advice for a mum and a dad, how we can protect our children? Because obviously they've been living in a bubble for quite some time now, especially the kids who've only been at home, and now they're back at school and we are pumping them with vitamins. Do you, as a pediatrician, have any advice? How can we be extra vigilant?
Yeah, that's a really good question, because we want our kids to go back to school, but at the same time, we want them to be safe. So it's a really good question. So there are no magic bullets. Make sure, as you say, you keep you keep their immunity up. And then secondly, we have to focus on the non-pharmaceutical measures. That's critical. And part of the non-pharmaceutical measures, as you know, masking, so wearing masks. But please note that children under the age of 12 are not forced to wear a mask. There are WHO guidelines that have been released. And so young children, it's optional for children aged 5 to 12 and not compulsory for children under the age of 5, just because it's hard for them to wear a mask all day. They don't wear them properly. And so they probably cause more harm than good. And these children are in a very delicate stage of their development. So we want them to learn to articulate. So just bear that in mind. So mask wearing, particularly for older children, hand sanitization, social distancing, and as much as possible, let them be outside. Let them stay outside. If any classes can be held outside, sitting around a tree, under a tree, cross-legged on the grass, which is so beneficial. Let them do that. So all the non-pharmaceutical measures and the infection prevention and control measures, so the sanitization in particular. So I think those are the things we've got to emphasize. There are no magic bullets. This is a disease that is completely controlled to an extent by the way we behave. And so, I think as adults, we need to set good examples and hopefully, make sure that in an age-appropriate manner, children will also follow. It's not, we don't want to be punitive about this, but we need to be reasonable. Children have to have fun, but at the same time, we want to keep them safe. So it's a really fine balance to strike between the two. But, let's be reasonable and let's keep their immunity up and kind of support them to take on these non-pharmaceutical measures.
Prof, I am extremely glad that I could talk to you today, because I also sometimes feel there's not always reason to panic about everything.
Yes, absolutely.
And we should talk about it. And thank you for your time. I really appreciate it. May we keep our kids just healthy and safe.
Absolutely, absolutely. Thank you so much, Mia. It's a pleasure.